Hi everyone, thanks for watching today. So today we're going to talk about prediabetes. So what exactly is prediabetes? In the simplest terms, your blood sugar levels are higher than someone without diabetes, but not high enough to be diagnosed with type 2 diabetes. So let's look at the slide and we'll see what those numbers look like. So you can see if you have your fasting blood work done. So this is fasting blood work is when you've been gone, somewhere between 8 to 12 hours without any food or beverages other than water or black coffee or black tea. You get your blood work done. And so your blood sugar for people without diabetes is going to be under 100. So pre-diabetes fasting blood sugar is 100 to 125. Or you can see if you have your hemoglobin A1C done, which a lot of people do for their annual physical exams, especially as we get older. Our healthcare providers like to keep on top of that. And you can see that that's 5.7 to 6.4. So when you have those results, you're going to talk about those with your healthcare provider. But maybe your healthcare provider didn't think it was time yet to check it. Maybe you're not in the age range to check and you want to find out if you have any risk for prediabetes. Because some people are more likely to develop diabetes over time than others. So some of the risk factors are going to be on the next slide right here. So take a look at those. So there's an actual screening tool that was developed. There's a couple of different versions, but they're pretty much the same. One for the Center for Disease Control, one from the American Diabetes Association. You can find that at diabetes.org. And I really do encourage people to complete the screening tool because if you have prediabetes, you really need to know about it. So the Center for Disease Control, or the CDC, reported that between 2017 and 2020, an estimated 38% of everybody in the United States had prediabetes, but only 19% of them knew about it. So the two important reasons to want to be in the group that knows that you have prediabetes is even in prediabetes phase, so this is before type 2 diabetes has developed, some of those complications can already be starting to happen. So you want to be able to do something about that. And the most important reason is because there are things that you can do to delay or even prevent the development of type 2 diabetes. So now you've maybe done the screening tool from the CDC or the American Diabetes Association. You had some blood work done with your healthcare provider, and you found out that, yes, you do have prediabetes. So what do you do now? Well, you talk to your healthcare provider. So, here at Latham Medical Group, we've got a whole bunch of people that can help. Myself, of course, being a diabetes care and education specialist. But we also have extra support. So we've got one of our physician assistants, Rachel Gelfman. She actually has a degree in nutrition as well and is a certified nutrition coach. So we've got our behavioral health team. If you need some help making lifestyle changes. But there's all kinds of stuff right here at Latham Medical Group. But if maybe that doesn't really feel like a good thing for you right now, or if you're somebody that isn't a patient here at Latham Med, there are programs. It's called the Diabetes Prevention Program. And this was developed by the Center for Disease Control about 12 years ago now. And at this point in time, since COVID, a lot of those are now available online in a telehealth version. So it's not something that you have to do in person all of the time. It is a year-long program, so it's intense, and you really do need to be committed to it. But one of the great things about it that they have proven time and time and time again is that it really, really works to help delay or even prevent development of type 2 diabetes. If you go to, I'll flash that website for the CDC where you can find those local diabetes prevention programs. But one of the other things I want to point out about it, so when they were developing the diabetes prevention program, one of the things they found was that losing just 7% of your body weight significantly reduces that risk of developing type 2 diabetes. And so for most people, 7% of body weight is somewhere between 12 and 20 pounds. So if you've been that kind of person that's maybe had difficulty for a lot of years achieving or maintaining a healthier weight, 12 to 20 pounds might sound overwhelming, but again, you can join that diabetes prevention program, and most insurance companies these days reimburse for that, and it really is effective to help you achieve that weight loss. But if the thought of doing that year-long commitment doesn't really fit into your time frame right now, make sure you talk to your healthcare provider, whoever that is. Ask them to help you set some goals. Maybe ask for a referral to a nutritionist or a dietitian, whatever is available to you. Talk about medications that can help you achieve your weight management goals. There's a lot of different options out there now. But the most important thing to take away from today's session is there are things that you can do now to, again, delay or even prevent the development of type 2 diabetes. So be sure to find out if you're at risk, talk to your healthcare team about it, and stay healthy, okay? So we're going to run down for today. Thank you so much for being here. Next time I see you, we're going to talk about hyperglycemia or high blood sugars. Thanks so much. I'll see you next time.